Do you worry every time you go to pick up your child that this might be the time when you bend over and you get that sudden jolt of back pain and you can't stand back up again? Or does your back hurt every time you go to pick up your child, but you just grin and bear it? Or do you minimize the number of times or even avoid picking up your child because it hurts your back? If so, keep watching and I'll show you 4 movement hacks that will likely help to eliminate or significantly reduce your pain. So the first thing you can do to eliminate your pain from picking up your child is to avoid moving your back when you bend forward. So when I bend forward, you can see my back round and then unround. So you don't want to have that happen. So I'll show you again, that's round and unround, or you don't want to twist. So twist to the side or twist to the other side. Rather, what you want to do is you want to keep your back still when you bend over and come back up. So no rounding, keep the back still. That's the first tip. The second movement hack is very closely related to the first one, and that is keep your back neutral when you bend over. So hip hinge, use your hips to bend over rather than your low back. So usually when we bend over, we use our back some and our hips some. So now what you're going to want to do is you're going to want to avoid using your back and you're going to want to use all hips. Often I'll tell people, or I'll show people how to do this by using a stick or dowel or a broomstick. So put that on your back, and when you bend forward, you want to have the stick touching the top and the bottom of your back the entire time. So you can see that is keeping your back neutral. That is not. Now your neutral posture is basically how you have a bit of a low back round when you're just standing tall, normal. This is what we call neutral posture. So you want to try to keep that when you bend over. That's tip number 2. The next thing you can do to help reduce or minimize or eliminate the pain you have from picking up your child is to keep your child close to you when you lift him or her up. So if this was my baby and I was going to pick her up, I want to make sure she stays underneath my belly button or close to my body rather than having her way out in front of me. So from the side, have baby close rather than way out in front. That way, when you come up, there's just less compression, less strain on your low back compared to if you have baby way in front of you. You can think of your spine as a flexible rod with a guy wire system around it. Now the muscles around your torso, the front, sides, and back are those guy wires. And so sometimes it's quite helpful to tighten up those wires a little bit in order to keep your spine stable as you bend forward to reduce any sort of pain that may happen when you bend over to pick up your child. And so the way you do that is if you gently push your thumbs into the side of your stomach, a little bit to the side of your belly button, and then tighten or stiffen your stomach muscles by pushing your thumbs back out. So I don't want you to see how big of a stomach you can give yourself or suck your stomach way in, but rather you want to tighten your stomach muscles. So if you take your thumbs, gently push them into the side and then just tighten your stomach muscles to push them back out. Now you don't want to do it so hard like to pretend someone was going to punch you in the stomach or something. Just a little bit of tension to tighten up those guy wires, those muscles around your spine to keep your spine stable as you bend over to pick up your child. So push your thumbs in, gently tighten, and then keep that tight as you go forward to pick up your child and come back up. So those are the 4 movement hacks that I find myself most commonly giving to my patients that come in with back pain or who have back pain when they pick up their child. Give them a try them all, see which ones work. Maybe just one will be good for you, maybe you have to do more, maybe you have to do all 4 to get the best results. And don't be discouraged if it doesn't seem to work for you. Maybe you'll just need a little help from someone to fine-tune them a bit, or maybe you need a different movement hack, as we call them. These are just the most common ones I find to be helpful. Again, there's more you could do depending on your condition. Thanks for watching. I hope that's helpful.